Hello, everyone. I'm Hartford Healthcare's Tina Verone, and we thank you so much for joining us. We're talking about a difficult and somewhat sensitive topic: what to do if you discover your elderly parents need help. Here with me is Karen Pagliaro from Hartford Healthcare at Home. Karen, thank you so much for being here with me today.
Thank you.
Well, you know, this is the time of year. You know, we've gone through the holiday seasons. Everybody's come home, you know, for the holidays. Maybe they haven't seen their parents in a while. They come home, they see things might look a little bit differently with their elderly parents. What is the first thing you should do if you notice things might be slightly different?
Well, I think first you need to really examine or be non-judgmental with your parents and to look and see what has changed. Are there papers piling up? Are they perhaps not eating well? What about their finances? Have they done something that's a little off-key? I'll give you an example. My mother-in-law one time had a money order, and I was helping her with her finances, and she had whited out the amount on the money order and wrote in a new one. So that was a red flag to me, and I ended up bringing her to the physician because I was like, what's happening?
Now, did you ask her, or did you immediately just take her to the doctor's office?
You need to be work with your folks. A lot of times parents might be a little bit hesitant to move forward, or even hesitant to ask for help, or they will say, "Oh no, I'm fine."
Right.
But as the sandwich generation, so to speak, you really need to do that non-judgmentally, approach them gently, and to really advocate for them and work with them. You can't do it all on your own. You need to do it together.
And it's a somewhat tough topic too, because you know you're saying how do you broach that topic with them? You know, if you say, hey, you know, I noticed that you whited this out on the check, and oh no, I'm fine. So where do you take it from there?
Well, I think an honest conversation with them is what you have to start with. I've noticed some changes. Have you noticed some changes? And then if you have specifics, you can, Mom, have you noticed that you're not paying your bills on time? Another time, somebody came into the house and tried to sell something to my mother-in-law. And it's like, Mom, do you realize what's happening? And we don't want you taken advantage of. So I think you have to also come from a side of you want them protected.
Right.
And I think once you work in concert with them, that's very helpful.
Right. Independence. Let's talk independence. That's such a strong word for, you know, our parents, because giving independence up is a big deal.
Oh,
we
absolutely.
all love our independence. So how do you approach that subject with them too? Like if it's something with their driving that, you know, maybe they have to take their license away. Independence. How do you even get to that point?
Well, I think that you have to look at the parent and, you know, work with the parent's physician as well. There's actually a program that you can bring your parent to where they would retest them. And I'll give you another example. One of my friend's father was newly diagnosed with dementia, and he didn't want to give up driving. So they ended up taking him to this program. He went through the test and he passed. So they ended up saying, yes, you can drive, but here are the restrictions. So you may be making some change in their independence, but still allow them to have that feeling that they're independent. Again, I think you need to do it in conjunction with a parent, and I think driving is probably the hardest thing to do.
Sure, absolutely. Stubbornness,
Right.
another adjective that I
Exactly.
want to use. So you have independence and you have a parent who's stubborn. So if they say, you know, no, I'm fine, I'm absolutely not going to give up driving, or whatever the issue might be, how do you deal with stubborn aging parents?
Well, again, I think it's got to be slow, and I know this sounds bad, but methodical. You know, I'm noticing this, Mom. I'm noticing this, Dad. Let's just try. What if we just try it once? I can give you another example. I have actually an aunt who has dementia, and we wanted our cousin who lives with her to be able to get out of the house. So we went to Independence at Home, and they have dementia-trained CNAs, or certified nursing assistants. And we said, we'll just try it once, Auntie. Guess what? She adores her, and she goes there every week. So it's like a win-win. But you know, slow and steady sometimes makes a difference.
Wins the race.
Yeah, exactly.
We're talking with Karen Pagliaro of Hartford Healthcare at Home. If you have a question, write in on Facebook. Karen would be more than happy to answer that question. Karen, I want to talk about home assessments.
Okay.
And I think it's important because you don't want to wait until the need is already there. I think preparation is so key because you don't want to make any sort of rash decisions. You want to really think about this through. And the home assessment is something I think that is very worthwhile for folks to have before you actually need it. Is that right?
I agree. I think sometimes you don't even consider home care or private care in the home until there's a crisis.
Right.
And you don't want to get to that point. You want things before. So actually we have a couple resources with Hartford Healthcare. One is our Center for Healthy Aging, where you can make a phone call and you could have a health professional out free of charge to your home, where they can help you, your parent, they would do a home assessment and then make some referrals if they need, or at least provide you with the information that you need to do that. We also have another program at Hartford Healthcare at Home called our Transitional Care Nurses. They are fabulous nurses, and this one is also free. We do need a physician's order to make that visit, but they go out and they can assess the client, see them in their home. A lot of times when a person goes to their physician, the physician's seeing them not in their home.
Right.
They don't know that there might not be anything in the refrigerator, or that their home, they're not able to make it into the bathroom, and they have piles of, say, Depends. So having that nurse come out and do an assessment in the home really makes all the difference. And again, too, that nurse can make referrals.
What does the home assessment consist of? What happens when they come in?
Well, first they would gather some facts. They would do a verbal history on the person, and then they would do a physical assessment as well, and right from head to toe. They would do blood pressure and pulse. They would listen to their lungs. They would check to see if their ankles are swollen. They want to know if that person can actually take off their shirt or their sweater. Can they take off their pants? Can they tie their shoe? Can they take off their socks? Because one of the things they want to look at their feet too. So, and as a nurse, sometimes it's very hard to do this, so you can't help the person. And so they would remove their socks and their shoes. And if they can't do any of this, how are they getting dressed in the morning?
Right.
Or are they staying in their pajamas and robe all day?
And I think what's important too to mention is that these are nurses coming into the home, so they can also look at their medication supply as well, which is key.
Absolutely. And a lot of times you could have people that either are not taking their medications correctly, they may be doubling up on a medication.
Right. Expired medications, maybe?
Exactly. And then it's just even the manner. There could be some on the kitchen table, some by the bedside, some by the chair that they sit in the evening when they're watching TV. So most definitely, some of the things at Hartford, at Independence at Home, we have automatic medication dispensers, and that's another thing. If you're just worried solely about medications, you can do.
Right. We have a question from Brenda on Facebook. She's concerned that dementia may affect the ability to utilize home care. Do you have dementia-trained specialists?
And yes, we do. We have both in Independence at Home, we have dementia-trained certified nursing assistants, and then at Hartford Healthcare at Home, we also have dementia-trained registered nurses and LPNs. So we can definitely assist and really provide wonderful feedback and referrals if they're needed.
Yeah, now let's talk about if they can't stay at home any longer. We do have facilities that at Hartford Healthcare, so let's talk about some of those options.
So I can give you an example. Even with my mother-in-law, when we knew she couldn't stay in the home anymore, we ended up going to Arbor Rose in New Britain, and that's an assisted living. We have a number of assisted livings under Hartford Healthcare, and they are truly fabulous. They can provide not only meals and some of the housekeeping that people need, but they can do med reminders. They can help with filling the meds so that they're they're getting them on time. If a person can't bathe on their own, they can help with that. But the best part is there's that social aspect too, so that they're really embraced in these wonderful home-like settings, having a social activity, and they could do exercises and they can do puzzles, and we have our veterans liaison coming out. It's really a wonderful way for somebody to grow old and remain independent.
And there's so many great events too that we put on throughout the year for the residents there as well.
Exactly, exactly. Our veterans liaison goes out once a month and does coffee hours for the veterans. They have blood pressure clinics. When I go there, sometimes I hear them playing bingo and there's sing-alongs, and it's fabulous. I love it.
So I think, yeah, it is a transition, and it's that transitional period, but we do have folks that help with that transitional period if you're coming from your home into an assisted living facility.
Yes, yes.
Let's talk about that transition.
So we have people at each of our assisted livings, and they can go out and work with the family, you know, the children or the spouse of the person who has some dementia, and they definitely help to make that transition in. There is an assessment that's done, and a registered nurse would go and do that assessment. I did one for somebody recently. I saw him at the assisted living, and I said, "How's it going?" He's like, "I love it here." He's at Cedar Mountain Commons in Newington. And it just brings a smile to see somebody who's flourishing and enjoying himself.
Let's talk about the children in this aspect, because, you know, this is somewhat of a, well, it is a role reversal. You know, you grow up as children, your parents take care of you, but now the roles are reversed and you're taking care of your elderly parents. What's the advice? What do you recommend for children with aging parents, how they can cope with this transition as well?
Well, I think part of it is to realize that you are a partner with your parent, and then to provide them with the opportunities and the care that they really need, or in the case of going into assisted living, with being in a place that can take care of the whole person, not just one portion of that person.
Right, because the support system is so crucial.
Exactly. And I also know that we offered dementia support groups for families, so that if your family member has dementia, you can certainly go to that. I think it's amazing what Hartford Healthcare offers for people in the community.
Yeah, for really everybody.
Exactly.
If you're just joining us, we're talking to Karen Pagliaro from our Hartford Healthcare at Home. You know, we're also children, as we were talking, children taking care of parents, but these are children who maybe even have their own children too. So it's sort of, there's layers there, if you will.
Exactly. And so when your parent is, say, at an assisted living, I think it's a little easier sometimes, because you know that they're being cared for. There's there's a nurse on call 24 hours a day, so you could bring your child to the soccer field and watch them play a game and know that your parent is safe.
Right,
and that's what you want. You want your parents safe. You want them to be happy and safe for the entire life.
What about if you're the child taking care of your elderly parents? Let's say they're living with you and you're the caretaker. How do you know, or what advice do you have for folks in that situation that, you know, maybe assisted living might be the way to go, or how do you know when you need to transition to that point?
So
when you're so used to living with your parents.
And I think this is the perfect way to have one of our transitional care nurses make a visit, because they can really help the person see things that they might not see. Because
you're living it every day.
Exactly. Or you may not really be wanting to see it. So sometimes having that impartial person that comes in, it can make a difference for you. Or it could be that they don't need assisted yet, but they could use some independence at home and have some private aides and support them. Or even a life alert, or the medication boxes that I was talking about. It's really there's a lot of things out there that we can provide.
For really almost any scenario,
exactly,
right?
Exactly.
And I think, too, if you've been taking care of your parents, if they're living with you, especially for many years, would you say it could be sort of a gradual, because it's hard to let go.
It is.
You know, it's
It
really
is.
hard to let go, let's face it. So would you say it could be a gradual thing, like having a transitional nurse come in and say, you know, maybe she visits a couple of times during the week to take
Right.
some of the burden off
Right.
of
Right.
off of you as the caretaker,
Right.
especially if you're juggling work and kids yourself.
Right. So another example that you can tap into is if your parent is living with you and you're worried about them during the day, we also have adult daycare that they can go to. So your parent can go there for the day. Again, there's that social aspect. They can interact, have a meal. It's really very fabulous. And then you have peace of mind while you're
Right.
at work.
It's, again, goes back to that role
Right.
reversal that we're playing.
Exactly.
We're talking about healthcare from a different angle. There are hospitals, but healthcare of the future is really at home. How are we keeping people at home in the comforts of their home? Because frankly, that's where they want to be.
I think that we have a great team, and that's really important. So if you have a parent who's at home, we can provide care that keeps them there and meets their specific needs, because that's what you want. You don't want it to be just, well, let's do this, this, and this. We want the care that meets the person's needs. So you really need an individualized plan, first and foremost. Then, if that's not enough, we can add something else. So we can have layers of care to provide that at home for the person.
So and it's great having the transitional nurses and having nurses, you know, who are highly qualified, who can really come in. It's not just somebody coming in to do a home assessment. I mean, these are qualified healthcare professionals
Correct.
that are coming in. Is there anything that you do to tell folks out there to prepare for a home assessment? What's some of the things that you should be doing to help prepare for that?
So whenever one of our nurses goes out for the first time, they usually ask for certain things. If it was our certified care with Hartford Healthcare at Home, we ask that they have their insurance cards out, because insurance does cover home care. We ask that they have their medications out. And if they've transitioned from the hospital or one of our partner skilled nursing facilities, we would want to have any papers that they've had. And so an initial visit could take up to 2 hours while they're there. The other thing that we do now, too, is we help with an emergency plan, so that if case of an emergency, even something like some of the snowstorms we've had, that they would know exactly what to do and who to call. So we really try to prepare that person for what they need.
Yeah, and I also think, too, that it's important to know that if you are, again, we were talking about that crisis point and not getting it to that point because you are going to make rash decisions, that this is sort of a gradual process. And just because a transitional nurse is coming into the home doesn't necessarily mean, hey, you have to go to assisted living,
Exactly.
your life's going to drastically change. We want to make
Exactly.
sure that that's not always the case. There are
Exactly.
plenty of other options.
Exactly.
And that's why I think the home assessment is so important, to see what's right. But I think people get a little nervous, and rightfully so. They think, they're going to take me out of my home, my independence is going to go. But no, that's why that home assessment with a qualified healthcare professional is so vital.
Absolutely.
Because there are other alternatives. And I want to make sure we stress that because I think
Exactly.
that people feel like it's all or nothing at this
Right.
point, right? Do you find that?
I agree. So you might make an initial visit, an assessment, and the person may only need life call or life alert. Just because this way, if they should fall, they're able to contact and get help.
Right.
Or they just need, like my aunt, 4 hours a week of care. And she loves it, and she feels pampered. And
Right.
it's a great way. Nobody has to go too far. We
Right.
need to just take small steps to make people safe.
Right, sure. And technology too, telehealth, is that something that you're seeing a lot of? That's something that we can do?
So right now for us, our telehealth consists of cardiac telemonitoring. So if a person has had congestive heart failure, or if they have COPD, then we can put in a cardiac telemonitoring unit. It's not covered by insurance. We feel it's wonderful. And what it can do is once a day at a specific time, the person would be prompted to take their blood pressure and pulse. There's a machine that does it, their weight, and then they answer some questions. There's a nurse on the other end in real time is able to see the questions, get the information about pulse, weight, and blood pressure. And then if there's an issue, they're able to contact the doctor or contact one of our nurses to go out and make a visit so that we can help to prevent unnecessary hospitalizations or doctor visits.
Right, and all from the comfort of your own home, which I think is so important because sometimes it's hard for them to get to the doctor's office, and this way it's almost consistent monitoring.
Right, exactly.
Yeah.
Exactly.
In case you're just joining us, we are talking live with Karen Pagliaro of Hartford Healthcare at Home, and we're talking about what to do if you have aging parents and how to broach the subject, different types of options that are available to you if you just are finding yourself in this situation and you don't know what to do. Karen, there are so many options, and really it is on a case-by-case basis. This is not a one-size-fits-all, and I do think that that's so important to stress is that not every situation is the same.
Correct, correct. Actually, one of the things that we really need to do is make an individualized plan for that particular person. So you never have the same plan for two individuals. But the other part of the plan is you might plan to have, say, a physical therapist come in and help the person walk. Well, it may be 10 feet, and then they reach that goal, so now they make a new plan, and they continue. Maybe their ultimate
You're always
goal,
modifying that plan. Yeah,
exactly.
Yeah, because it does change along the way.
Does.
Is there a certain age that children should start to maybe have this conversation with their parents, or is it based on their physical ability and their health?
Well, I from my own experience, I'm a nurse. I think that it's better to do it earlier.
Right.
I think I waited a little too long with my mom and dad, but I'm already having that conversation with my kids now. So I don't think it's ever too early. It's probably always better to start and have a conversation.
And you start with the conversation. So, so you have the conversation, everything goes well. What should be the next step if you notice that things might be changing?
Well, I think, again, it would depend on the parents' needs. So with my mom, right now we want to get her a cane because that's what she needs. So again, it's little things. You have to really look and see what that need is and go from there.
Yeah, and the the caregivers themselves are so passionate, and you're a nurse, you're passionate about what you do, and it takes a certain person to do these kinds of jobs, and we see it all the time, the great lengths that they go to care for their patients. There was a story during the last snowstorm that we had, major snowstorm that we had, someone from Hartford Healthcare at Home was going to see her patient in the snowstorm. That patient was having a stroke, got the patient to the hospital, shoveled the driveway so that the ambulance could come in. I mean, these are just incredible acts going above and beyond. You're a nurse. Talk to us about that sort of that feeling for your patients.
It's truly amazing. I've worked in this field for a number of years, and some of the things that I've seen the nurses do. One very large snowstorm, we had a hospice nurse, make a visit by snowmobile. We have, in other snowstorms, we've had some of the inside staff, the non-visit facing staff, they will drive a car, because a lot of our cities and towns will have parking bans. So they'll drive the car and they'll go around the block and around the block so the nurse can go in and do that. We've had people who've gone in and they haven't had food in the house. We've had them go out and buy food and bring it to the home. It's just amazing what these people do sometimes. And they're a caring group of people, the aides and the social workers, the nurses, the physical therapists, the rehab specialists. It's like I'm at a loss for words because they are such a wonderful group of people. We recently had one person who was homeless, finally had an apartment, but needed didn't have a bed. So the social worker worked to get her a bed.
Wow.
I mean, so this woman now has a bed to sleep on.
Yeah, yeah.
It's fabulous.
You know, I think it goes above and beyond nurse and patient.
Right.
I mean, these are actually, you form a family.
Right.
Right? I mean, they're almost taking care of them as if they were a family member.
Right. It's true. There's people, as a nurse, I will never forget certain clients of mine, and they'll be part of your memory forever. And there's nothing better than walking into a person's home, and remember, it's a privilege to walk into somebody's home.
Right.
We're a visitor in their
Right,
home.
right.
But when you walk home, and like on Christmas, they'll say, "What are you doing here?" It's like, "We have to come and do your wound."
Right.
And it's like, oh my God, you're the only person that person will see that
Right,
day.
right.
It's a fabulous feeling.
It has to be so rewarding for you,
is.
right?
It is.
To see, I mean, you're actually making a difference in someone's life.
It is. It really is. So, and our nurses aren't just in the home. We do flu clinics. We do and this weekend we were part of the state initiative, and the people waited 2 hours to get a flu shot. And when they walked in, they said, "You're angels," to the nurses. I mean, how great is that?
Yeah, that's a pretty priceless feeling. Catherine on Facebook says, remember it's important to monitor and any pay giver and loved one's home. And it's important to note that these staff members are at Hartford Healthcare and dependents at home go through a very, very rigorous background check and work with supervisors to make sure that these caregivers and your loved ones are safe. Let's talk about some of the checks, the background checks that they have to go through, and the qualifications and the guidelines that they have to meet to qualify to be a caregiver in the home.
So we do background checks, not just in our state, but in other states. And they go through specific trainings, especially if they're dementia trained, that's more training. Our employees at Hartford Healthcare at Home are now fingerprinted. So it's truly a rigorous process. They also need to provide proof that during flu season that they've had their flu vaccination, and TB, they need to have proof of that as well, that they've had that TB time test. So we definitely want the best person to go into the home, and we want that person to be safe. So I think that distinguishes us from some other private duty companies who don't do that. We do that, and we stand by our employees that they do a great job.
And the dementia specialists, you mentioned they go through a little bit more training.
Exactly.
Talk to us about their training and what they have to go through.
Well, I don't know what the training is for the CNAs, but I know that our nurses, we have the behavioral health unit, they went through a course and became certified. So I apologize that I don't have that information.
Yeah, no worries. But it is important to know that with a large organization like Hartford Healthcare versus some other companies that may not do background checks, because are there places out there that don't do background checks that people need to be aware of?
Yes, there are. Yeah. There are. And we want our parents and loved ones safe.
Yeah, sure. Well, they can do any little things from laundry to drive loved ones to appointments, really keeping them independent. And I think that's also important too, because you want to make sure, give them little tasks to do as well, to keep them feeling like, hey, I'm doing this, although I'm getting assistance, but I'm still able to do this on my own.
So to give an example, if somebody's came in to do some housework and light housekeeping, and part of it was laundry, well, what you can do is you can fold the clothes together.
Right.
You know, give that person a purpose. You know, here, let's do this together. Or when they're preparing meals, invite them to help. And, you know, oh, I never knew how to cook this. Why don't you show me and work together?
Right.
So it's really important that you really find the perfect caregiver for your parent.
Yeah.
And they're out there.
They are, yeah. We see them every day.
Exactly.
If you're just joining us, we are talking with Karen Pagliaro from Hartford Healthcare at Home. We encourage you to ask Karen a question, anything about home care. She'd be happy to answer that question for you. So when we talk about sort of like this overall situation with our parents, I think too, is sometimes parents are together, sometimes there's just a recent loss of a parent, which is a different scenario. And another case where somebody coming in from Hartford Healthcare at Home or Independence at Home coming in is company too. Like it could just be an ear to talk to or somebody, because it does get to that level, right?
Yes, yes. So when my mother-in-law lost her husband, my father-in-law, he had been the person who was doing the caretaking.
Right.
And we didn't realize that my mother-in-law had dementia. We just didn't know it because he was really doing so much of the caretaking. And that's when we really needed help. And that was many years ago. If we had that now, a phone call to Center for Healthy Aging would have been like the perfect way to go. And I wish we had that then because it would have made a big difference. But the other thing too is if the parent who suffered that loss, we also have bereavement support groups through our hospice program as well.
That's important too,
It is.
You know, because especially if you have a couple, they've been married, say, 50, 60 years, you've spent literally your entire life with that person, and then all of a sudden that person is no longer there. I think that's really important. You often hear of people, they die of a broken heart.
Right.
Bereavement is so important. Talk to us a little bit about what to expect in a bereavement sort of support group.
So they do have, it's ongoing. They also send out literature that's ongoing too, and after a person dies, they support the survivor for up to 13 months. So it's really important, and it helps get over that first year with the first anniversary of death and really to heal and be able to continue to grow and feel whole again.
Karen, thank you so much for joining us today.
you.
We really appreciate that. We hope that you found this enlightening and got something out of this discussion today. We thank you for joining us. For more information, please call 1-800-HOME-CARE, and also for a free assessment too if you so choose. Thank you again for joining us. I'm Hartford Healthcare's Tina Verona. We'll see you soon.